25 strategies to help you eliminate wrong options in NCLEX exam. I will show you each strategy point-wise along with examples for each strategy, and then we will practice a case question related to each strategy. I will give the easy, obvious questions just to let you memorize the strategies. And this video is equally beneficial to students looking for a near NCLEX RN or NCLEX PN exam in future. If you learn by heart these strategies properly, you can help yourself actually to save your time in selecting the right answers. Sometimes the wrong answers are so obvious that seeing few words in options and applying few strategies can help you eliminate the obvious wrong answers. Let's start with the strategies. Avoid absolute words. Options with words like always, never, or only are usually incorrect. Let's take an example. A patient with diabetes should never exercise is likely wrong, as exercise is often recommended with proper precautions. Watch out the absolute word never in this case. Never exercise. That would be wrong. Now that you have learned so far, let's try to solve a question. The nurse is educating a patient about preventing respiratory infections. Which statement by the nurse is most accurate? The options given to you in the screen are: Option A. You should always wear a mask, even at home, to prevent respiratory infections. Option B. Respiratory infections are never caused by bacteria, so antibiotics are not needed. Option C. Hand hygiene is the only step you need to take to prevent respiratory infections. Option D. Washing your hands frequently and maintaining a clean environment can help reduce your risk of respiratory infections. Watch out for the absolute words such as always in Option A, never in Option B, and only in Option C. Seems like this question was easy to solve. The only option remained is Option D now, which says washing your hands frequently and maintaining a clean environment can help reduce your risk of respiratory infections, which is so true. So, Option D is correct option for this question. Let's watch for another strategy to look for eliminating out the wrong option. Watch for irrelevant details. If an option has unnecessary information, it's likely incorrect. Let's take an example. The patient must be moved to a different room when the question is about monitoring vital signs is likely irrelevant. To understand this in a clinical scenario, let's look at a question. A 45-year-old patient arrives at the emergency department after a motor vehicle accident. The patient is conscious but complains of severe abdominal pain. Their blood pressure is 88 systolic and 56 meters m of diastolic readings, heart rate is 120, and they appear pale and diaphoretic. What is the nurse's priority action? The options given to you on the screen are: Option A, administer pain medication to address the patient's discomfort. Option B, obtain consent to move the patient to a private room for observation. Option C, initiate large bore IV access and administer IV fluids as prescribed. Option D, call the patient's family to notify them of the situation. So, we just read that irrelevant information must be eliminated. Here, the case is an emergency, so unnecessary details like moving patient to private room is so obviously unnecessary. This question is in fact easy to follow, as I have taken only easiest questions in this video so that students of all levels feel easy to understand. So, what could be the right option for this question? Please write on the comments below. I will discuss about the right answer of this question later in this video. So please keep a note of the right answer in the comment and please watch till the end of the video. Let us now see another strategy to help select a wrong option. Choose action over observation, basically in urgent cases. If action is needed, observe or monitor responses are often incorrect. For example, the statement, monitor the patient's airway, may be wrong if the patient is choking. Action is needed in this case. Let's see a similar scenario to follow this message. An 82-year-old patient in a long-term care facility is found unresponsive and breathing irregularly after choking on food. The nurse notes cyanosis around the lips. What is the priority action? The options given to you on the screen are: Option A, monitor the patient's oxygen saturation using a pulse oximeter. Option B, administer oxygen via nasal cannula at 2 liters per minute. Option C, perform abdominal thrusts to relieve the obstruction. Option D, call the healthcare provider to report the situation. So what could be the obvious wrong answer in this case? Watch for any words like monitor or observe in the urgent cases. They might not be fitting in such scenarios usually. So the first option, monitor the patient's oxygen saturation using a pulse oximeter, is wrong. So what could be the right answer? Please pause this video and write in the comment section. I will explain the answer to this question later in this video. Keep on watching. Let's see another strategy. Avoid new or experimental treatments. The NCLEX prefers evidence-based interventions over new methods. For example, try the latest herbal remedy is likely incorrect as it's not a standard intervention. Let's take a question similar to example just described. A 70-year-old patient with chronic pain due to osteoarthritis asks the nurse about trying a newly advertised herbal supplement for pain relief. What is the best response by the nurse? Your options are given in the screen. Option A, you can try that herbal supplement as long as it's natural. Option B, new treatments like herbal supplements are usually better than traditional medications. Option C, I recommend discussing this supplement with your healthcare provider before trying it. Option D, herbal remedies are completely safe and don't interact with other medications. Option B is obviously incorrect following this strategy, but what could be the right answer? Please write in the comments section. I will reveal the answer to this question later in this video. Just keep on watching. Let's see another strategy to help eliminate the wrong answers. Ignore options that defy basic physiology. Choices that contradict physiology or standard patient care are often incorrect. For example, elevate both legs for a patient with heart failure is likely wrong, as it could worsen symptoms. Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Next Gen NCLEX RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions. You've got this. Let's see a case similar to example mentioned here. A 68-year-old patient with a history of congestive heart failure is admitted for worsening dyspnea and bilateral lower extremity edema. Which nursing action is most appropriate? The options given to you on the screen are: Option A, encourage the patient to drink 3 liters of water daily to improve hydration. Option B, elevate both legs above the heart to reduce swelling. Option C, position the patient in high Fowler's position to improve breathing. Option D, apply a warm compress to the chest to reduce fluid retention. Following the strategy we discussed earlier, the most obvious wrong option is elevate both legs above the heart to reduce swelling. But what is the right answer and how do you know? Just write in the comments section for saving. I will explain the answer later in the video. Let's see another strategy. Reject answers that aren't therapeutic. Responses that lack empathy or therapeutic communication are generally incorrect. For example, the statement, "Tell the patient to stop worrying," is non-therapeutic and likely wrong. Let's see a case similar to what we saw in the example. A 40-year-old patient recently diagnosed with type 2 diabetes tells the nurse, "I'm so worried about managing this disease. What if I can't handle it?" What is the best response by the nurse? The options given to you on the screen are: Option A, don't worry, you'll get used to it over time. Option B, why are you so worried? It's a manageable condition. Option C, it's normal to feel overwhelmed at first. Let's talk about what specifically concerns you. Option D, You should focus on the positives and not think about the negatives. Here in this scenario, the only right answer is option C. Can you explain why? Please write in the comments section. Let's now see another strategy. Choose specific over vague answers. Specific, actionable responses are usually better than vague ones. For example, administer oxygen is better than help the patient breathe better. Let's take a case question similar to example we discussed. A patient admitted with pneumonia suddenly develops respiratory distress, with oxygen saturation dropping to 84%. What is the nurse's priority action? Here are the possible options. Option A. Help the patient breathe better by ensuring they are comfortable. Option B. Administer oxygen therapy as prescribed and monitor oxygen saturation. Option C. Make sure the patient feels calm and reassured. Option D. Improve the patient's breathing by adjusting the bed to a comfortable position. Option A. Help the patient breathe better by ensuring they are comfortable is too vague, so obviously it's not the right answer. Can you guess the correct option for this question? Just write in the comments section and I'll discuss it afterwards in this lecture. Beware of unnecessary medications. Avoid options with medications not typically indicated for the scenario. For example, administer insulin to a non-diabetic with a fever is likely incorrect. Can you eliminate all the incorrect answers for this question? A 72-year-old patient with chronic kidney disease presents with signs of fluid overload, including edema, shortness of breath, and weight gain. Which medication should the nurse administer as part of the treatment plan? Options given are: Option A. Administer insulin to help manage the fluid overload. Option B. Administer furosemide as prescribed to help reduce fluid retention. Option C. Administer morphine to relieve shortness of breath. Option D. Administer aspirin to reduce swelling and discomfort. What do you think would be the right answer, and which options do you think are so obvious that you can easily cut out? Please write in the comments below. I will show the answers later towards the end. Let's go to the next strategy. Watch for options with redundant or repetitive actions. If the same action is suggested twice, it's probably not needed. For example, check blood pressure 3 times may be redundant and incorrect. Let's try to solve another case problem similar to the example given. A nurse is assessing a patient who is post-operative following abdominal surgery. Which of the following actions should the nurse take first to assess the patient's cardiovascular status? The options given to you on the screen are: Option A. Check the patient's blood pressure, and then check the blood pressure again in 5 minutes. Option B. Make the patient's blood pressure, and then listen to heart sounds. Option C. Check the patient's blood pressure, pulse, and respirations, and then repeat the assessment in 10 minutes. Option D. Measure the patient's blood pressure, pulse, and respirations, and then check the heart rate again in 5 minutes. What do you think is the right answer? Please write in the comments. I will show the answer of this one too later in the video. Before that, let's go to another strategy. Eliminate overly complex responses. Responses with excessive steps or complexity are often distractors. For example, sterilize the room, gown, and gloves before examining a cough patient is excessive for standard infection control. Let's see if you can solve a similar problem. A nurse is preparing to assess a patient with a suspected respiratory infection. Which of the following actions should the nurse take to prevent the spread of infection? The options are: Option A. Sterilize the patient's room, gown, gloves, and all equipment, and then wash your hands before and after patient contact. Option B. Wear a surgical mask and gloves, place the patient in a private room, and then disinfect all surfaces after patient contact. Option C. Wear a gown, gloves, and an N95 mask, place the patient in an isolated room with positive pressure, and disinfect all items used after the exam. Option D. Wear gloves and a mask, wash hands before and after patient contact, and clean all equipment with alcohol-based wipes. Here in this question, is incorrect because sterilizing the entire room, gown, gloves, and equipment is excessive for standard infection control measures. Sterilization is unnecessary and beyond what is needed for routine care. Congratulations! You have come to the end of the video, but these are just 10 out of 25 strategies. There are more. I will provide the link of other strategies at the link in the description below. So now, let's see how many of you scored correctly. I will give the answer of all the questions here. If you have scored at least half of the answers correct, please write in the comment how many of those questions you scored correctly, and I'll personally write you back and select you for NCLEX Fast Track free crash course. Please check the link in the description for the free crash course. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck! You've got this.